Okay,
so
this
now
is...
we have the chairperson scientific committee, the past secretary of AIOS, because this job she undertook when she was secretary of AIOS, and we were, in the office, and we had this TASS reported from all across the country. So it was the onus of AIOS to, do something about the benefit of our members. So Namrata will present how did we tackle this TASS epidemic.
Thank you, sir. I think this TASS outbreak occurred last year, and it was reported from several cities in some kind of intraocular lenses from all over the country. And under the leadership of Dr. Lalit Verma, who at that time was the president of All India Ophthalmological Society, we did take certain steps. So as soon as it was reported, communication was sent on an urgent basis to all in the country. And the second communication again went, and we requested all the members to send sealed sample of the intraocular lenses from the batches that enclosed for fair evaluation to the headquarter. And then we did have an open forum discussion on which we discussed everything that was related to TASS. A survey on TASS was done for this particular episode, and there were about 42 people who reported to the survey. And the responses were how many surgeries, especially the ones who had TASS on that particular OT or that particular OR. And there were several responses on the numbers of the cases they had undertaken, numbers where TASS was reported, what was the visual acuity, what were the features, pain, corneal edema, whether it was there or not, did they use steroids, what was the pupil, and all the features which we've already discussed, and if aqueous and vitreous tap was sent, and what was the report, as well as the type of the surgery and the method of sterilization and the reuse of the instruments. Then we have managing committee members, and again to them also we send communication so that in their respective states they could report it. All these samples were sent to laboratories, and we sent this, which were received from the AIOS office. Packets were made, and these were sent to the laboratories as well as to the company where the intraocular lens was implicated, and as is customary also to the regulatory authorities. Now, TASS registry is already in place on the AIOS website, and this has now been renamed as Ocular Adverse Event Registry. So if there is an ocular adverse event which you have, you can always go to the AIOS website and you can report it. That helps us to know whether a particular kind of ocular adverse event, whether it is TASS or it is endophthalmitis, is related to the operation theatre, because always it may not be related to operation theatres. It may be because of the disposables that you are using. It could be irrigating solution, it could be viscoelastic, it could be intraocular lenses. And although the surgeon is generally responsible for that, the manufacturing companies do not hold or do not share responsibility for that, and sometimes it can be because of the products and not because of the surgical environment and not because of the surgery itself or the surgeon. So this registry is now renamed as Ocular Adverse Event Registry, and we had sent this to 2 laboratories, and both the laboratories said that there were no organisms or nothing that was reported which could be incriminated for the TASS, and both the laboratories were certified and government approved. So in the amount or the concentrations that we should have these endotoxins, it was not present actually. Then subsequently, to remove bias, we also sent it to the US laboratory. And in the US laboratory as well, we did not find any endotoxins, but they did report pyrogens. But as it would have it by FDA also, that if pyrogens are present, then they are not prerequisites for TASS. So these are the steps that we had taken, and of course the samples were withdrawn, and subsequently now it was not reported ever since that. But this, I want to just highlight that once an adverse event happens, you should report immediately, and all of us have to get on the common platform. Subsequently, a representation was also made to the authorities, that is to CDSCO as well as to DCGI, that not only the surgeons should be incriminated when an ocular adverse event like endophthalmitis or TASS occurs, But the onus and responsibility should also lie with the manufacturers, because sometimes it may be that the manufacturers are at a fault and surgeons get wrongly blamed for it. So the responsibility should be shared equally, if not equally, then partly by the manufacturing companies as well. So these are some of the reports and then all the steps taken during TASS. So thank you very much for your kind attention, and I think this was a very important topic, TASS and endophthalmitis. I would request Dr. Samar Basak to please conclude the session.
For this complete session. And in 2007 we heard a lecture in ESCRS that which one is the deadliest? Is there anything worse than endophthalmitis? That time there is a nice lecture, I have forgotten the name of the professor who has given, but it came out TASS, because endophthalmitis you can always, as Malika will also agree, the early intervention and immediate, it will most of the cases solves the problem. But TASS, sometimes it is so severe, it goes on and on. You do whatever, ultimately that eyes goes to thicycle. So you must remember this too, and that's why TASS is also important, and you have to report if there is a cluster of 3, 4, 5 patients in your setup, and try to investigate and try to find out the reasons. Thank you very much for your patience here.